Good afternoon. Please note that this session is being recorded. If you do not consent to being recorded, you are asked to drop off the session at this time. Thank you. My name is Adriana Marzette, and I'm a public health program coordinator with the National Indian Health Board. Today, I will be moderating today's Don't Miss Your Shot COVID-19 Youth Summit session. Today's session is entitled Youth How to Talking to Adults About Getting or Considering the COVID-19. And our presenter today would be no other than the fabulous Tommy Ghost Dog. Before we get started with today's presentation, I just have a few housekeeping notes that I just want to throw out there. Today's session is being recorded, as I stated earlier, and the viewing will be made available on NIHB's YouTube channel and our website in the next week around next Thursday or Friday. All participants have been muted. Please leave yourself on mute unless Tommy specifically asks you to unmute and engage. If you have any questions for Tommy, please do not hesitate to use the chat feature or to use the reaction to raise your hand so that he or I can see you and you will be able to speak. We will hold most questions until the end of the session. Unless Tommy chooses to have an interactive, I will let him make that decision. But if you have any technical questions, as if your Zoom starts acting funny, please do not hesitate to directly get in contact with me. The presenters, Tommy's PowerPoint presentation slides will be available for download after today's session. They will be available online on NIHB's website. So do not worry if he says something or if he changes the slides. All of that information will be made available to you. So without any further delay, I will turn it over to our speaker for today, the fabulous Tommy Ghost Dog.
Awesome, thank you. That was a great intro. I'm pumped up now. That amped me up. Go back to my glory days in high school when they announced me for a basketball game. Sweet. Thank you so much. And I just want to thank everyone for being here today. I know how Fridays can be. So I just want to first say, I just really appreciate everyone joining in on this session or watching it later if you're watching it in the future right now. It takes a lot of time, to sit, and Zoom fatigue is very real. So I just want to really show my appreciation for everyone joining us today and come in and listen to me ramble. But again, thank you to NIHB for inviting WeRNative. We're super excited to be a part of this important summit. And I want to just give a shout out to my two other co-workers, Roger and Selena, who are doing a session right now, but for the opposite, adults talking to youth. So definitely want to give them a shout out as we're part of an awesome team at WeRNative. And the health board in general. So again, thank you all for joining in. And with that, I will go ahead and do my little intro and we can get rolling. So I have enough time and I want to respect everyone's time. And also if there is, Q&A, I'd be happy to chat and create dialogue around this important topic. So as mentioned, my name is Thomas Lee Ghost Dog Jr. I'm enrolled Burns Paiute, but I'm also Oglala Lakota on my dad's side. My mother is Twyla Tiemann out of Duck Valley, Nevada. It's a small reservation in northern Nevada on the border of Idaho and Nevada. Her parents were the late Jane Thacker of Owyhee, Nevada, and Ross Tiemann of Burns, Oregon. And my father is Thomas Lee Ghost Dog Sr. out of Pine Ridge, South Dakota, and his parents were the late George Ghost Dog and Virginia Brown Eyes from Pine Ridge, South Dakota, the Porcupine District. So I was born in Salem, but I was mainly raised in Burns, where my little tribe is in Eastern Oregon. And I just wanted to introduce myself, but also my family. That's who I speak for, who's behind me right now, even though they're not behind me. It's always just a nice a nice, reminder for myself to kind of ground me in why I do my talks, why I do the work that I do, and who's with me, not only my family but my community and all my support system. So definitely want to make that acknowledged. I'm the WeRNative project coordinator at the Northwest Portland Area Indian Health Board, which is located in Portland, Oregon. WeRNative is housed in one of 12 tribal epicenters throughout Indian country. So we're very, very fortunate enough to really be driven by data with our work, but also work alongside amazing, not only adolescent health programs, but programs in general that we all partner with. So I also want to give a shout out to our COVID team at the health board. I've been picking their brains for this session, as they're the true experts. I'm more of a messenger. So if you have questions, ask them, not me. I'm just playing. I'm going to be doing my best to answer questions. And if I don't know the answer, I promise you, I will get you in contact with someone that does. So I just want to put that out there as well. So with that being said, we'll go ahead and get started. For this next couple slides, I just want to start just with a little fun. I know how it can be. Again, I said Zoom fatigue is very real. But if you are able to have your chat feature ready, if you don't know where the chat feed is, if you're not familiar, it's just that little bar underneath. I will be doing a fun emoji game. And what I like to do is really start with this to break the ice, have some fun, have some laughter. But within my presentations, I really want people to gain something from presentations, and whether that's the topic at hand, resources, or tools that I do within my own PowerPoint that you can take and use and adapt, because that's what we're all about, right? Is adapting things that work for us. So this fun emoji game, like it says, each slide is going to have a different emoji, and you're going to try to guess what that emoji is. And so it's all references to natives. So hopefully some of them you'll recognize, some of them might be a little tough. It starts out a little slow, but they get tougher. So if you're ready, have the chat feature pulled up and we'll go through these slides. So the first one, starting out. Let me pull my chat feature up so I can see. Anyone? Oh, okay. Adriana, all right, I see you with the fast fingers. Okay, that was just a warm up. That was a warm up. So let's go to the next one. Yep, Lacey, Adriana. Oh, all right. See, that we're getting the hang of it. We're getting the hang of it. Let's go to the next one. Ooh, Lacey's on it. Let's go. Jingle dress. I like it. See if Lacey could go 3 for 3. Pressure's on now. Anyone? I'll give you a hint. It's a food you can find at a powwow. Hey, Lacey goes 3 for 3. She's batting 1,000. All right, let's go here. Get a little harder. A little tougher. Ooh, Doreen, you're close. You're close. Carmen Sanders. Yeah, land back. Let's go. So it's land back. Doreen, you're close. Ooh, Doreen, are you gonna type it again really quick? There you go, Doreen, right there. Water is life. Nice. That's like you saw ahead to the slide. That was nice. Last one. Oh, Lacey, just before Carmen. Nice. Awesome. Well, thank you for joining along on that. I hope it brought some smiles to your face, even though everyone's camera's off, which is no biggie. But again, if you like that game, there's a lot of ways you can adapt it if you can imagine. We've had youth and other young adults and other Native communities create their own emojis based off of landmarks from where they're from, based off community, different pop cultures. You could do, movies, all Native movies if you wanted. So again, feel free to use that as an icebreaker and just to have some fun and really kind of wake your brains up. So thank you all for participating in that. But with that, I'll just start jumping in with the presentation. And yeah, I just wanted to also say, I don't know how many youth are on here, but I know as adults, I just wanted to put it out there that, I feel like it's when it comes to COVID-19 and vaccines and everything, in that manner, it's super important that we all be open-minded, in a sense that, I'm a firm believer in everyone has their opinions, and I respect everyone's opinions. It took me a lot to figure that out and mature into that role. And so, with the boom of COVID, it's been really tough. I'm being completely honest, it's been really tough to respect others' opinions, especially when it doesn't agree with my own. But I just ask that, in this space, I just want everyone's, respect to be mutual with what we talk about in the dialogue, and just putting that out there as I know this is a tough situation for some, and I'm no different. I have family on both sides of it. And so it's been a very unique learning experience for myself. And I'm always trying to be positive about it and in the light and when I share information. So I just wanted to put that out there first and foremost, but let's go ahead and jump into it. So these first few slides, I just wanted to, kind of let you know the website that I help out with that's housed at the Northwest Portland Area Indian Health Board, what we do with the website and how we push our health messaging through WeRNative. So WeRNative is a multimedia health resource for Native youth, by Native youth, as well as young adults. And it's a website that was created by my supervisor, Dr. Stephanie Craig Rushing, and shout out to my coworker, David Stevens, as well. Back in 2012, they launched the website, and this was launched due to the need and the ask of our Northwest delegates that we serve from Oregon, Idaho, and Washington. And they wanted us to reach youth, Native youth, where they're at. And it was technology back in 2012. And so we started out very sexual health focused, but we quickly learned that Native youth and young adults want more of a holistic approach when it comes to their wellness and their health. So what my supervisor did, and David, they went back to the drawing board and they did, they looked at it more holistically. So we have sexual health on our website, of course, but we also wanted to mix in, your body. So having a sense of, information to learn about, healthy foods, exercise, just physical activity in itself. But we also wanted to encompass the, your mind and how you can, navigate through tough mental situations and how to navigate, different scenarios in life that put, a lot of pressure on you or your friends. And so, with that, WeRNative was born, and also, having that kind of engagement community piece. And really for this slide, I'd just like to really focus in on the over 400 health and wellness pages. And so what that kind of means is that we partnered with the Northwest tribal college up in Washington, as well as other tribal schools and health educators. And we sent them these articles and said, hey, do these make sense? Do you understand them? Should we change some language? Because we want our users to really understand the content, that it's, medically accurate, that it's not, these crazy big medical terms, but more so terms that Native youth and young adults would understand. And so they reviewed those for us, and then that's what you see on our website. So, we really strive to meet where youth and young adults are at, both, social media, language, pop culture, and also the trending, whatever's trending. We really try to be relevant to push our health messaging, because we know that's the way, we're all constantly trying to meet them halfway. So this is just a screenshot. I don't necessarily want to focus like my whole time on WeRNative. And the best thing I can say is going to WeRNative.org and just kind of get lost in it. We strategically, maneuvered our pages after, a few kind of, remaking of the website. So we want people to just get lost in it, in a sense where they can click an article and, a related article will come up. So, there's only so much I can do and talk about, a slide on WeRNative, rather than, maybe after this during your lunch break, or a break you have, just going to WeRNative and checking it out and seeing what we're all about, and letting us know, we're constantly adding new features to our website. And that's what these arrows are pointing to. So, mental health, especially through COVID, was big. And that's something that, Native youth and young adults expressed is, dealing with the impacts of COVID, right? Not going to school, not being able to play sports, not being able to socialize. And so what we did is we went to work and we built up our mind section, and we redid our resources. We really beefed it up to make it, more relevant to today's youth and young adults, so they're able to get resources that they need, resources that are truly helpful. And we also added an Ask Uncle to our Ask Auntie feature, which I'll talk about a little later. But we're actually already improving that section of our website. We're moving it to Ask Relatives. Our team has grown, and we understand that uncles and aunties are very important in Native culture and Native communities. But so are cousins, right? We all have our crazy cousins who give us advice. Sometimes it's not the best advice, but sometimes it truly is helpful. So, we wanted to really kind of get that sense as well. And so we changed our Ask Auntie and Ask Uncle section to Ask Relatives. So our team grew, so did our website. And so we're super excited to bring on new team members to help answer questions that Native youth have, throughout their daily lives. So that was just, an overview of WeRNative. Again, I just highly suggest that you are able to just, go to our website, cruise through it, and let us know what you think. But I'm going to try to, change focus here to really hone in on, why we were asked to come to, NIHB and speak on this topic. And again, I want to say, I'm no expert myself, and everything I learned is, through trial and error, through, doing my research, doing, just really collecting information to really hone in on what I do as a person and who I am as a person, and right. And it all, really boils down to making informed decisions, because I think that, when it comes to Native youth and young adults, when I was a Native youth and young adult myself, it's the age of talking at Native youth and young adults is over. And I'm a firm believer in that, right? Because when I was younger, I wanted, adults or people that I viewed as adults to talk with me, not talk at me, right? And I don't know if I'm not a parent myself, but I can almost guarantee if we have parents on here that, if you try to talk at your kids, they're not going to really listen. But if you talk with them, it's more of a dialogue. It's more of, just conversations. And so that being said, I really was thinking about putting these slides together, and and this theme kind of kept popping up in my mind, and that was making informed decisions. Because you can't tell people what to do, right? I think that's a big kind of issue in public health, is we try to do prevention, and prevention really works if you trust it. But when you get from prevention to really trying to tell people what to do, everyone's their own self and everyone makes their own decisions. And so I think as individuals, what we can do is help make those informed decisions. And this is the approach that I take with youth and young adults, and it goes back to talking with them and not at them. Is helping them research, helping them in providing them medically accurate information, which we have on WeRNative. But ultimately it goes back to those old school marketing campaigns, in my head that pops up with smoking and drugs and alcohol. And it was the message was, don't drink, don't do drugs, and that was it, right? So what do you want to do? You want to you want to see what the drugs are about, you want to see what this, and right, it's not really, in my eyes, effective, because you're just, again, you're talking at someone, you're telling them, don't do this, don't do that. But if you rather speak with them and give them information and let them know, this is what could happen, this is what happened, and if you're able and comfortable, share a personal story. And that's really what I've been able to do with talking with other adults, even is really sharing experiences to make them think, right? To make them understand or see the situation in a different light. And so that's why, informed decisions was my main theme that kept coming across. And according to Webster Dictionary, informed decision is a decision based on facts or information, right? So with that being said, I think when it ties back to the vaccine and making a decision, I feel like this is where it can kind of get cloudy, because a lot of people have what they think are facts. I'm a little blurry, but I'm doing air quotes, facts or information. And then when you truly find out their information, they got it from a Wikipedia page, or they got it from what's that one, The Onion, where they create fake headlines and, to get people riled up. So it's really, on us as adults, but it's on other youth and other young adults to start help creating those, accurate narratives, those, posts that have the accurate information. And I think that's what we can do as health professionals. But if there's any youth on the phone or on the call or on this, session, it's really on us too, to, have ourselves look into these situations and not be, biased, and not, have a weighted decision because it's what's trending, right? Or because it's what you heard from your parents, or because it's what you heard from your guardians. And it's nothing on them, but if you do hear something, Google it, start your own research, find credible resources. I'm one, I myself, after this talk, I can give my contact info. And if I don't know something, I'm going to do my, my darnest to help you find that medically accurate information to help make your informed decision a lot easier. So with that, I really wanted to formulate this presentation in a sense that, we're talking to youth, and we're talking to young adults who want to approach an adult, or who want to talk to a loved one, maybe an older adult who is vaccine hesitant, who, might be anti-vax, to really, give them those tools to help make, that person an informed decision, right? So that's the goal of what I really want to share. And that's, part of the ending of this presentation is giving you resources to do so. And there's no right or wrong, one step cookie cutter way to do it. But it starts here, right? We're laying foundations, and I'm a firm believer in anything that you want to succeed, you need a strong foundation. And then so I consider this just, the starting of a foundation, to where after this presentation, you can take what you heard, what you learned, and build on your own foundation. So really a stepping stone is my goal of this presentation. So really, having that being said, I'm framing this as things to think about, right? So with any, research type paper, any article, peer-reviewed type work that you're doing, the first thing is you just have to start your research, right? Knowing myths from facts, but also finding those accurate facts to really, push your work in what you do. So these were the three main myths that I really have heard from other youth, from other young adults, and adults themselves even. So, really addressing those and taking those head on. So myth one is that, natural immunity is better than vaccine acquired immunity. So, in this case, I mean, natural immunity, I think there's a common misconception of what natural immunity might be. But it is meaning, you have to, unfortunately, get COVID, get sick, and that, that's when it does build your stronger immunity. But, I think what a lot of people don't understand is, doing it this way is super dangerous. You're putting yourself, your loved ones at risk for, getting COVID and not, following safety protocols that go along with getting, COVID, isolating, making sure you don't contact, trace contacting, all that, kind of health information. So, that this myth that I think is really that misconception, and it's not truly understood for what it is, right? It reminds me of that saying that Rome wasn't built in a day. But the full quote, if you read that full quote, it goes on to say that Rome wasn't built in a day, but it did burn down in a day. So it's like people don't really, they want to, they want to pick their favorite part of the quote without fully understanding it. I think that's kind of the misconception that comes along with this myth of natural immunity is, how do you get to natural immunity? Ask those open-ended questions to say, how are we getting there though? How does this happen? And it happens with others, receiving and getting COVID, which is what we want to avoid. And then, I think the second myth I've really seen is that, we don't need vaccine or a vaccinate. We don't need to vaccinate because the infection rates are already so low in the US. And again, it goes back to that, the Rome wasn't built in a day, but if you keep reading it, burned down in a day. So the way you get to herd immunity is through vaccination, right? Is through getting the population around you vaccinated and everyone helping to do their part to where there's more vaccinated people than there isn't. And so, that's another misconception with that herd immunity, myth that's saying, oh, well, 70%'s already, got it, so I don't need it. Well, other people are taking their responsibility and putting on themselves. So, it's more than you need to think about with, the herd immunity side of things. And then, the last myth that I've really heard a lot is, better hygiene, sanitation, let's Clorox wipe everything. Let's, anything you touch, wipe it down. My hands are getting raw from using hand sanitizer. That's all true. But at the same time, I think there's a deeper, dive that you could go into this myth because, those are ideal situations. And, what I read about this myth was that, they use measles as an example. When the measles outbreak happened, they looked at the sanitation of things and people were, saying, we need to, sanitize, but then the numbers show that as soon as the measles vaccine came out, the numbers were still high with the hygiene and sanitation side of things, right? But as soon as the vaccine came out, those numbers dropped. And so that's what we're seeing with, the COVID-19 vaccine is that, reading into the full extent of, why we wear masks, why we social distance. Yes, those are very strong factors to help, limit the spread of COVID-19, but, you can't discredit the vaccination for not being a part of that big, kind of push with the health sanitation. And so, those are the three myths that I've, heard personally through, young adults to youth, to older adults, to elders. And I think, that's a great way to start when you're thinking about talking to an older adult, is really gathering your facts, gathering true information that, from credible resources that you can trust to have, so if you do come across these myths, like look into it, look into what people are saying, but do it in a respectful way, right? Because the the underlying message goes back to, we want to talk with people, not at people. We want to have conversations, not arguments. So really, being that person to look into this information is very big. So moving along, another important thing to think about, and again, this is more tailored towards the youth and young adults on or watching this presentation, is really knowing, the rights that you have as a young person. And vaxteen.org is a really awesome site. I have that it's pretty simple, vaxteen.org if you go there, but they actually have a feature on their website where you can pick your state. They have all the states listed, and you can click on your state and you can learn or, look into the consent laws in your specific state. So just out of curiosity, I looked up Oregon. As I mentioned, that's where I'm from. That's where I'm living right now. And in Oregon, you need to be at least 15 in order to receive the vaccine without consent from a legal guardian. So, if I was 15 and, I was in a household, unfortunately, that, where it was anti-vax, I would know from this resource that in Oregon, I can go get a vaccine if I'm 15. So really, kind of understanding the rules and regulations that you have on yourself and maybe your peers is super important, to know and to understand. So again, vaxteen.org is where I got this, and it's super helpful. If you have other youth or young adults who are friends that, are not in a situation, maybe their parents or their legal guardians don't believe in it, you can show them the site and they can understand and know the rules within their specific state if you're in different states. So I thought this was really cool, but it goes back to, collecting facts from trusted resources. And I feel like I'm gonna use that phrase a lot. And I think it's that important. I don't want to sound like I'm continuously repeating myself, but I am, because it's super important to understand that, you have your facts from trusted, credible resources. And I can't stress that enough. But really, when we have like our foundation of, the medically accurate information, maybe some myths that you understand, I think when it comes down to it and actually talking with that older adult or older person, is really talking with empathy and understanding. And it goes back to the beginning of what I said, with being talked with, not at. And I heard this phrase, and it just like, it blew my mind. It's have a conversation, not an argument. And no one's perfect. I'm guilty of this myself. When you get so passionate about a topic, you start to use more hand movements, you start maybe bobbing your head a little bit, you get, more, your body language starts to come out. But I think also, personally, it was a growing stage for me, and it was a maturity thing for me, and everyone's different, right? But really understanding that everyone has the right to their own opinion, and everyone, ideally would respect someone's opinion, right? In what they choose to believe in. So it's that maturity level of having a conversation around this and not an argument, and really understanding that, we're talking this out as adults. We're talking this out in a sense that, we want to be civil, and really having empathy. But some really, kind of key factors to kind of help you have that conversation rather than argument is asking open-ended questions, right? Asking for them to have responses more than yes or no, more than, just one simple answer. So think about some open-ended questions that you can ask that person to really have them explain, in why they, they're not choosing to be vaccinated, and why they, aren't understanding, the safety around the vaccine. So again, really having them create dialogue is gonna help this conversation flow. And again, there it is again, show credible sites so they can look into it themselves. Don't send them to a Wikipedia page, don't send them to, some fan page or some conspiracy page, but look into places like the CDC, look into places like WeRNative.org, vaxteen.org, send them to credible sites so they can truly understand and read for themselves, and have that sense for them to help, to help them make a better informed decision. But a last one that I really like to to, have people understand is help them find their why, really understand, like truly help them find their why, like why not? Why are they choosing not to be vaccinated? Why are they choosing, not to partake in any, type of COVID precautions? So I really think is helping them find their why is super important, in a sense that, you encompass all of these traits that I just went over when you do help them find their why. And, from there, you can't, that's all you can do to help them make an informed decision. So really honing in on these bullet points is super important. And the last thing is really leaving this conversation with, how can I get involved? So, I think what this really means, and again, this was tailored to youth and young adults, is really helping them get involved, is really understanding that community is stronger than the individual, helping them look into the mind frame that you're not being selfish and not, you're not being selfish because you're getting the vaccine, right? You're being selfish if you're not, because the community is stronger than the individual, and that holds true for any community, right? I'm a big sports person, and I think that translates to me is like, you're only as strong as your weakest team member, which isn't, in a sense, it looks bad, but that's a sports sense. So I'm saying that, you want to be strong as a team, you want to be strong as a community. And so if one individual is, lacking that area as a community, we shouldn't shun them. We should help build them up, right? We should help them understand the importance that we do have a responsibility, right? We have a responsibility in keeping our community safe, which the next bullet point is help prevent hard lessons. And so what I mean by that is helping prevent hard lessons translates to, having a person that or personally have been affected by COVID, who, someone might have lost their life, right? That's a hard lesson. So I really, I think it's the overarching theme of public health and prevention is we all want to help prevent hard lessons. We want to help prevent, deaths that could have been prevented through different measures. And so really helping the individual that you're talking to understand that. And then the last bullet point is thinking of those who are asymptomatic, right? So a lot of people, I'll be honest, I'm not even gonna front, I'm not gonna cap. When I heard asymptomatic, I was like, man, that's a health term. Hold on. I gotta go look it up again because I've been so far out of college. But when I found out asymptomatic, I think that word gets thrown around, and people like me, I'm not too embarrassed now. I'm an open book. So I'm just gonna be real. I was like, asymptomatic. What is, I have to, it kind of just it floated around in my mind and in there for a while. But once I truly understood it, then it's like, okay, that makes sense. So having people understand that what that term really means, having preconditions. So, being older, having a weaker immune system, having pre-existing conditions. So all of these are factors that I think, that come along with that word asymptomatic. And if we're able to break that word down in talking with other people, sadly in Native populations, there's a lot of high rates of very negative things, right? That all could be included in that asymptomatic stage. So, when I had talks with my friends, I told them that, and they thought asymptomatic meant something different. And so when we had that conversation, I made them really think about their informed decision, because, their grandparents who, that were their caretakers all their life, all of a sudden they were put in a different room and they couldn't see them, because they were choosing to be unvaccinated. And once they understood that, and once they understood the situation and the seriousness of it, that's how I help them make their informed decision on choosing to get vaccinated. So really helping people understand that conversation is super important. And then lastly, again, getting involved. I think this goes along with again, the youth and young adult focused, but reach out to your local health officials and hold virtual events just like this, roundtable discussions, have conversations, not arguments, right? I'm sure your local health authorities, your local health tribal clinics have COVID teams. They have, people specifically working on this. So reach out to them, say, hey, I want to hold a roundtable session with my friends. Can you Zoom in? I want and myself to learn more about COVID-19 vaccinations. I want them to understand, how I understood. Can we make that happen? And I almost 100% guarantee you, if you took the initiative to reach out to your local health officials and hold a virtual roundtable on COVID-19, they would do it like that. I would do it personally. If you want to get that going, let's go for it. I saw, oh, yep, there he is, Captain Tom Weiser. Reach out to him. He would hold a roundtable for you. So getting involved is huge, and it really helps you, but it's on you, right? It's on you as a person to take that initiative, and incorporate vaccine events with other local events. And what I mean by this, and of course, ask permission first, but, have vaccine booths information, if you want to get crazy, vaccine, handing out vaccines at a local event, just getting the information out there. So that could be, having a booth at a basketball game, having, walk, run, and then being, tying that with the vaccinating events. So that's what that means with that. And then lastly, just be informed. I'm hoping this is the last time I'm going to say it, but, find credible resources, find accurate resources that help you make your informed decisions so you can help your peers be more informed. So yeah, I'm going to start wrapping up. I know we're getting in on time. So if you have a chance, follow us on social media at WeRNative. We're on Facebook, Twitter, TikTok, Instagram. We put our health messaging out through social media. We have quite a bit of COVID content as well that is translated to youth and young adults. This is part of our Mr. Clean series. We did this, I was thinking, way back when, sanitation and having clean things was huge. And I thought to myself, what if Uncle Clean came to the res? What if Uncle Clean shacked up with an auntie and he had a res makeover look? So we put some braids on him, and we had a fun series with this. And all these images had important COVID-19 messaging behind them. But what caught the attention of the youth was the image itself first. So we're always open to helping you create messaging through your channels as well, if it does involve COVID, and having it spiced up a little bit rather than just kind of long captions and images that youth might just keep scrolling by. So definitely reach out to us and let us know. Resources for youth, if there's any youth or young adults on here, of course, WeRNative.org. We have our Ask Relatives section. If you have any COVID questions, I believe there's 10 COVID questions on the website already. So if you're interested in seeing those, check them out. My biggest one, honestly, is vaccine.org. It's an amazing site that is specifically tailored to youth and young adults. So any parents on here as well, if you have them, check out vaccine.org, or if you work with any youth, it's a great site, and it's very user-friendly to help navigate through different COVID information and questions they might have. And then lastly, Hip Hop Public Health is actually, I just found out about that resource, but it's pretty dope. I highly encourage you all to check it out. They have some pretty big names that are incorporated with that website, and they turn public health information into like hip hop songs. So it's pretty cool. It's really neat, actually. Lastly, of course, again, our Ask Auntie section. We have a text service. So if you text native to 97779, that's all mobile. So these next slides are just some campaigns that we have out. One of our most recent, which we're super excited about, is our partnership with the Crisis Text Line. They now have a native specific outlet. So if you text native to 741741, it'll be native specific content that has to do with suicide prevention and mental health. Again, we have our last one is text caring, and this is just really a more of an uplifting resource. So if youth are feeling down, we send them a text every Friday just to make sure that they know that they're awesome and to make sure that they have an awesome day. It's one of my favorites. And then the very last thing, get at our gear store. Our gear store is open right now. It closes tonight at midnight. So if you text the word gear, so GEAR to 97779, you'll get sent a link to our gear store. So you can buy our WeRNative hoodies, backpacks, sweats, shorts. It all goes back to our ambassador program. So help us out And with that, I'm done. My mouth is really dry from talking a lot, so I'm gonna swig some water, but I'll take any questions if anyone has them.
So while Tommy is taking a sip of water, I would like for everyone to use your reactions and show Tommy some love. Let's give him some hearts, some hand claps. Tommy, I mean, your presentation was very thorough. Thank you so much for like really going to detail about how youth can have those awkward conversations with family members that are vaccine hesitant, but then also how as adults we should also have that openness and that respect and being able to not talk at the youth, but talk with them so that they can feel more engaged and want to do more out in the community. So thank you for like nailing that so many times. In addition to sharing information about where all you can find other groups that's doing similar work and how we can get connected to WeRNative. So again, everyone have really participated today. I thank everyone that joined us today. Again, thank you, Tommy. Thank you for the active participation from my attendees. For those that came in a little late, you missed a goodie, but again, don't worry. Oh, we have one question from Carmen. I'm sorry, Carmen. Go ahead.
No, I didn't have a question. I just wanted to say thank you. I'm Carmen Sanders. I'm a member of the Macaw tribe, and I serve as a public health project coordinator with the National Indian Health Board. But I always say above anything else, I'm a mom, I'm a daughter, I'm a granddaughter, I'm an auntie, and I have had experience with some of my nieces and nephews who have their parents are not really anti-vax, but really unsure of the COVID vax, and have called me, hey, auntie, I'm thinking about getting the vaccine, and can you help me talk to my mom and my dad or whoever. So and that's what I usually do, is try to find resources. So I'm really glad you shared these resources, and I hadn't seen these yet, so I will definitely be sharing them. So thank you.
Can't get better than that. A live feedback review right there for you, Tommy. So you know you did a banger to our job. So with that, so again, thank everyone. Thank you, thank you, thank you. Our next session will begin at 4. We'll begin in an hour. So we're going on lunch right now. I know if you in Portland, it's lunch for you, right? Like this is official lunchtime because you're a couple hours behind us. So enjoy your lunch. Please get up, stretch, use the restroom, check your emails, and please come back in an hour after lunch. And we have 2 more sessions, and they're both really, really, really good. So again, thank you, thank you, thank you, and be blessed.